You have a headache, you have a joint pain, you have a pain at the shoulder, sometimes you have fever. So you reach out to a painkiller, and this painkiller have promised you a relief. Of course, they delivered. They have assisted you. Now you no more feel those pain. You no more feel those headache. That fever have subsided. Yes, of course. What if I told you that the same painkiller might be slightly burning a hole inside your stomach? What if I told you that such thing exists? Painkiller like Ibuprofen, diclofenac, aspirin belong to the group called the NSAIDs. What are these NSAIDs? I say they are the Ibuprofen, diclofenac, aspirin. They are the non-steroid anti-inflammatory drugs. What is their work? Their work is to assist you in getting relief from this pain. However, after their job in getting you relief from this pain, they can as well cause a burning sensation inside the stomach, and that is where you are going to be experiencing what? A hole, kind of a sore or a wound inside your stomach. How does this happen? Don't forget, the average stomach of a human being contains an acid that can dissolve a metal. The stomach also contains mucous layers. What is the work of these mucous layers? The mucous layer protects the stomach from the attack of this hydrochloric acid, so that this hydrochloric acid will not be affecting the stomach lining directly. So the mucus are naturally existing there to ensure that this hydrochloric acid do not attack the stomach lining directly. But the consumption or the steady consumption of this NSAIDs group of painkillers, I said they are the Ibuprofen, diclofenac, and the aspirin. The consumption or the intake of this diclofenac, Ibuprofen, causes the blockage of an enzyme that is being secreted at the stomach. What is this enzyme secreted in the stomach? We call it the COS1 enzyme. The COS1 enzyme help in what? In the secretion of what? Prostaglandin. Prostaglandin, like I said, is just that mucous layer that help what? To protect what? The stomach lining. When there is too much intake of this diclofenac and the ibuprofen, what happens? It causes what? A blockage of these enzymes. Therefore, the body could not secrete this prostaglandin. And when they could not secrete this prostaglandin, the stomach lining is being exposed. They are now vulnerable to what? To the attack of this acid. Remember, we said that this acid, they are in the stomach there. They aid us in digestion. They have been monitored again, and also being monitored and regulated by these layers, the natural layers in the body. The intake of this diclofenac and the ibuprofen inside now stops the COS1 enzyme that we are talking about. Now the stomach is vulnerable, nothing to protect it again. What happened? This acid begin to burn. The same rate is going to attack an iron. In the same way, it's going to attack the stomach lining. And when it attacks the stomach lining, what are you going to be experiencing? You are going to be experiencing sores. You are going to be experiencing wound. That will now bring me to what is ulcer. Ulcer is simply sore or wound that is located in the stomach or small intestine. Because the stomach will not protect itself again, this acid begin to what? Burn. And when they begin to burn, they begin to cause harm to the stomach. And that is when you begin to what? Experience weakness. You are going to be experiencing burning sensation inside of the stomach. So you are going to be feeling weakness around you, feeling like vomiting. These are the common symptoms you are going to be experiencing. Weakness, dizziness. These are the things you are going to be feeling, the common symptoms. How does this NSAIDs cause this? Basically, people that take medication without taking food, your doctor will tell you to take this medication immediately after meal. But you, because you feel that you are strong, you decide to take it without food by your side. Secondly, people that consume drugs and they are on alcohol, when you are doing that, you are exposing yourself to this ulceration. You are taking alcohol, you are taking spirits, you are taking beer, as the case may be. Another set of people is people that are at the age of 40, from 40 above. This thing I'm discussing about mostly affect our aged mothers. Those people that are prone to pain here and there almost every time. Our aged mothers, they are at the village taking painkillers almost every time. And tomorrow they are telling you they are having ulcer. I'm telling you that those ulcer they are having is not because they are not eating. It's not because they are not feeding well, but it's because of those pain relief that they do consume. Too much of pain relief relief without drinking enough water, without taking it almost without food, they are the ones that are at risk of this. Another people that are at risk of this is those people that combine painkillers. Some of them visit the drugstore, they collect all manner of concussion. You are missing diclofenac with ibuprofen. The only difference is the company, but you are combining. These are also the people that are at risk of what I'm telling you now. How are we going to manage this? Number one, if you are the kind of patient that do depend on this pain relief, number one thing you are going to do is ensure that you take drugs that also help to regulate acid level in the stomach. Drugs or medicine or medications that assist in regulating acid content in the stomach. Some of them are cimetidine, omeprazole. You must ensure that you take these drugs once in a while. These are the ways you can manage this. If you know that you will not feel yourself in the next 2 minutes, my friend or my mother, do not take these drugs at all. Wait until you have food. Avoid taking drugs on an empty stomach. Take drugs with enough water. Take these particular drugs, the painkiller we are talking about, with enough water. Please, if you notice dark stool, pain, discomfort, vomiting around you, visit your doctor. That is another way you can manage this. Do not stay at home and begin to conclude that it's an ulcer. Please visit your doctor. These are the common way this can be prevented. So do you understand what we are saying today? In as much as this pain relief are there to assist us, don't forget they can cause us harm. So the same pill that you take to relieve can silently burn your stomach. So next time you are feeling discomfort, maybe immediately after taking this medication, don't forget to visit your doctor to change medications for you. There are a good number of painkillers that do not contain these NSAIDs. We have the paracetamol and the rest. That is why you need to visit your doctor for prescription on which of them to use, whether it's a moderate pain or a severe pain. I know that this class is helpful. Please, if it's helpful to you, share to your loved ones and friends, and don't forget to turn on the notification button and give us a like. If there is any topic you want us to discuss or share, don't forget to drop it on the comment section. Thank you, and join us on the next one. Don't forget it is health breakdown. See you.